Welcome back to StartUpHealth TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. It's my pleasure to be here with Sarah Bishop. You are the Director of Operations at Mocingbird.
Yep.
Great to have you with me.
Yeah, thanks for having me.
You know, I've loved watching Mockingbird's journey for over the last few years. I've gotten to know different members of the team.
Yeah.
And I grew up with a dad who was a doctor, and I remember him spending weekends worrying about interstate credentialing, worrying about continuing medical education and the time that took him. The thing that I love about Mockingbird is that you are really giving doctors that time back that they were spending on credentialing, on CME. So really kind of break down the platform for us and what you're building at Mockingbird.
Yeah, so Mockingbird is a SaaS platform, and it really just customizes it for the clinician so that when you put your licenses in there, it's going to give the exact task list of what the requirements are for each state for their continuing education. So if a state has a specific human trafficking course or child abuse course, it's going to tell you exactly that needs to be taken. Not only the specific courses, but if there's a course you can take that's going to cover multiple states, it's going to tell you that too. So you're not taking extra courses that you don't need to, and you're not spending that extra time unnecessarily. And that's how it was founded. The two co-founders are physicians, and they both struggled spending holiday weekends doing CME requirements.
Paperwork.
Because they realized last minute, I got to finish these.
Not only do you have to do the paperwork, not only do you have to do the course and the paperwork, but you have to do the research to figure out what's required.
Exactly. And we have a whole rules team with clinicians on the team that are doing that continuing research to get those updates. Sometimes it's digging into administrative codes on the board's website. And I don't know how a clinician's supposed to have time to do that, where they're supposed to be focusing on patient care instead of digging through a board's website to try and find which course am I supposed to take, how many credits does it need to be, does it need to be category 1, whatever their specific requirement might be.
So you're making life better for the physicians, and that's great. What about on the hospital side, on the enterprise side? Kind of how do you make life better?
Yeah, so that's the thing. I've been in this industry for like 15 years. Okay. And so on the administrative side, where I've run teams and we're managing clinicians' licenses and privileging and credentialing. And I will say, as me and my team's job is to track their licenses and their education, I myself have made the mistake of, it's a week before December 31st, and I just realized there's a doctor that needs to do 40 CME credits by the end of the year.
Oh boy.
Because the state may have a specific requirement that the license doesn't expire until June, but you have to have those education submitted and taken by 12/31. We're not looking at our June licenses yet.
Yeah.
So if us, as a team our job is to focus on that, are struggling with tracking that, that's going to take that burden and stress off of us to be able to say, hey, we know exactly when looking at Mockingbird what Dr. Smith needs to complete,
And that's a workforce challenge where you're trying to make sure that staffing stays up. You've got workforce shortages, and so you don't want to compound the workforce shortage with a perfectly able-bodied doctor who isn't credentialed for a few weeks.
Yeah, exactly. Well, not only that, then providers are randomly audited by states.
Okay.
So you don't know when it's going to happen. Just a couple of weeks ago, I have a physician that's licensed in all 51 states with DC. He messaged me and said, I just got audited by the state, and he's freaking out. And I'm like, no problem. We logged into Mockingbird. Here's our certificates. He uploaded them.
Wow.
Total peace of mind within 5 minutes.
So without that, it would have been like, how's my filing system?
Yeah,
like,
he's got to find that certificate. Did I meet those requirements? They're not telling him, so he's got to go figure out what that is. And we had it all.
Like doing your taxes all over again.
Exactly.
But the only difference is that your livelihood is at stake.
Yes.
You could find yourself unable to even.
That's the thing. If you're not compliant, too, then some of the states are, taking disciplinary actions, and there's fines.
Wow.
And then you have to report that on your licensing applications for the rest of your career. And so then that follows your career. So
is the maintenance of certification and the credentialing, is it getting more complicated?
Yes.
You mentioned the thing about human trafficking and about child abuse, and it just makes me think every time there's a new sort of idea, protocol, there's going to be a new course. Is it getting more complicated?
Yeah, I would say it's more complicated, and it's becoming more complicated too with the telehealth. There's so many providers that are becoming multi-state licensed.
Yes.
And so there's nuances where states aren't even caught up on telehealth requirements. And so if you have a telehealth license, you may not have a CME requirement. You just have to follow your home state. But if you don't have a telehealth license, or if you have the specific type of license, or if you're prescribing opioids or you're not prescribing opioids, you're going to have different requirements. And Mocingbird customizes that, where we'll ask, do you have a DEA in the state? Are you prescribing opioids? And if the answer is yes or no, it'll change your dashboard to be customized to what your requirements are.
This is a platform that just makes so much sense. When you think about the old way, you're like, that's crazy.
Yeah.
This is in line with telehealth, with interstate, healthcare is what we need. Is the market getting more crowded? Are there other folks doing this kind of work?
I have not seen a platform that's doing it at the level that we are doing it. Okay. I've seen platforms that say we're CE tracking. I myself at previous companies have utilized like a continuing education section of like a credentialing software, but it's more like a glorified spreadsheet where it's like you have all the information in there, but you don't know if you're meeting all the requirements. You don't know what to have the extent of the rules, and it's a patent pending rules engine that we have on our platform, and our product and engineering team, I don't know how they do it, like work miracles, and it's an incredible system to take all that guesswork out of it. But I have not seen anything like that in the 15 years.
Yeah, sometimes you move from like sort of a dumb system, just not a lot happening in the background, to one where just all the pieces are connected. It's
exactly.
It's kind of like this magic that's happening.
Exactly.
Connects all the dots.
Yeah.
Last question, what's next for Mocingbird? What are you looking forward to?
Oh, we have exciting things coming up, some big opportunities, and we are offering licensing from end to end. So we're actually doing the initial licensing for providers and renewals. And
how is that different, since I'm not a clinician?
So actually like completing the paperwork for the providers and giving them the tools and where we can submit the applications on their behalf. They approve it, sign off on everything, but we're making it as a one-stop shop, end-to-end licensing, where we're tracking your education and your licensure and processing your renewal applications and everything as well.
All in one place.
Yep.
Bringing that blood pressure down, that, like making people feel, I think about kind of the first time I did my taxes with TurboTax.
Yeah.
And I just felt like, wow, it was relief that it had taken less time and less anxiety.
Yeah.
I can imagine a doctor sort of feeling that way about knowing my credentialing is secure.
Yeah, and that's what we want. We want the providers to be able to focus on patient care. That's what they're supposed to be there for. They don't need to learn. They don't need to be the accountant that's doing the taxes.
Exactly.
They need to be the clinician that's doing their patient care, what they do best, what they were trained for.
Love it. Sarah, thank you for the update. Appreciate the work that you're doing. You're helping a lot of clinicians, but also making the whole system work more smoothly. So thanks for coming by and giving me an update.
Appreciate it.